less chance of later kidney failure. So we borrow that because with these medicines we can reduce the urine protein by 50%. And that's key. The higher the urine protein, the more scarring there will be in the kidneys. Now, I also have to keep blood pressure under control. Now, of course we have to do that to prevent heart attacks, but it turns out we have to do that as well to prevent kidney failure. So it turns out that this is 120. 120 is normal. If the blood pressure gets above 120, the risk of kidney failure goes up. And can you see the lowest risk is when you get below 120. So I'm always going to be nagging you. I know I'm a nag. I'm a mother. Mothers are nags. Blood pressure, 1 point above 120, just 1 point above, increases the risk of heart attack, stroke, and kidney failure. So yes, it's so important. And you know how I preach healthy diets, like, low salt. These are all important. You think they're just important for everybody in the room? No. They're important for everybody in our population. Because we have a society that gets a lot of heart disease. Now, which blood pressure medicines are the best? Well, remember I already said that the ACE inhibitors that end in krill and the ARBs, which are medicines like losartan, are the best for the kidneys. So how good is the proof? You never want to be at the top box here, because that top box is kidney failure. So if we use amlodipine, which is a calcium channel blocker, you get to kidney failure faster. If we use one of those ACE inhibitors or ARBs, you get to kidney failure later, or hopefully not at all. So when you have blood pressure, I'm always going to ask you to take an ACE inhibitor or an ARB losartan. Now it turns out that hydroxychloroquine plaquenil is essential if you have kidney lupus. And how do we prove this? Because all of you who have kidney lupus are in our database. We learn from many. Hydroxychloroquine triples the chance that the kidney disease will be successfully controlled. That's huge. And we have to teach this to the kidney specialists. And they just published their guidelines for kidney doctors on how to treat kidney lupus, and they put this as one of their guidelines. And it never would have been there to help hundreds of thousands of people with lupus in the United States and elsewhere if it hadn't been for you. Now, mycophenolate mofetil is also called Cellcet, and it's been proven to be the best medicine for kidney lupus in the first 6 months. That's what's called induction. And for the years afterwards, that's called maintenance. Now, remember, every medicine can have side effects. But when a medicine is a really good medicine and the side effects are small, we accept it as the gold standard. So how much better is mycophenolate? Well, being straight means you're still in the remission. If the curve drops down, that means that the kidney lupus became active again. So can you see how mycophenolate is better than azathioprine? Now I know that some of you couldn't tolerate mycophenolate because you had gastrointestinal problems on it. So then we have to go to the backup medicine, azathioprine. But every single one of you in the audience who became pregnant, you know we're not allowed to use mycophenolate in pregnancy because it causes birth defects. So during pregnancy, you were on azathioprine. So I'm really glad we have that backup, but for 99% of you, if you develop kidney lupus, you will be treated with mycophenolate. Now you have to split the dose, because the stuff only is active in your body for an hour and a half. So here again, this is where that smartphone alarm is essential, because for mycophenolate to work the best, you have to take it with breakfast anyway. It turns out that your ethnicity matters. On average, Caucasians will need 2 grams, and African Americans will need 3 grams. But that's on average, and so many of you are exceptions. And here are the warnings. Now, by the way, lupus increases infection, and lupus increases cancers like lymphoma, and lupus important example is called cognitive impairment, the memory problems, the senior moments when you're not a senior. 10 years after the diagnosis of lupus, only 21% of people with lupus have completely normal memory. For the other 80%, it's mostly on the mild side. It is mostly like a senior moment. But I know you notice it. You tell me you notice it. When it gets more severe, I will actually send you to the cognitive psychologist to measure the memory, to tell me which parts are most affected. In mice, this has all been figured out. In mice, there's an antibody called anti-NR2, which causes the cognitive impairment. And it can actually be blocked in mice. People always ask me, how do you test memory in mice? They put them in a little swimming pool with a platform. It's called a swim maze. And the mouse that's got the brain lupus gets mixed up and is getting really tired and it can't find that little platform. But for those of you who are concerned about animal research, do not worry about this mouse. It's worth $5,000. Do you think they ever let a single mouse drown? Of course not. There's a research assistant there who will scoop it up as soon as it starts to tire. But this is how animal research may someday benefit human lupus. Unfortunately, this antibody, which is so important in the mouse, is not important in human lupus. But it means that there's hope, right? Maybe there's another antibody, another lupus antibody that's affecting the brain, and a research laboratory will discover it. Now, many of you are helping with this. So all of you who help with brain connections and cognitions, where you sat there at the computer and did all those memory tests, this is what you are helping with, to try to find what antibody is causing memory problems in human lupus. Now, when we published the brain connections results, were really surprised because I thought that the memory problems would happen after people had lupus for several years. And it turns out they're present at diagnosis. And these are the different memory tests, and this is the proof that they're, on average, worse in people with lupus. So, that's bad news. It's there at diagnosis. So how can you prevent something that's already there? But now for the good news. Everybody who's in brain connections, remember how you came back every year? Well, we were able to prove that people at Hopkins and Cedars-Sinai and University of Texas, nobody got worse. So once lupus is treated in an academic center, the memory problems don't progress. And we found that there was part of the memory problem that could be treated, depression. Now, by the way, I and the doctors at the other medical centers missed this. But the patient missed it too. You know how we picked it up? Questionnaires on depression. It's called the Beck Depression Inventory. Depression can be there without either the patient or the doctor recognizing it. And by the way, if you feel that you have depression, don't be afraid to bring it up. Because there are non-addictive medicines that can help the underlying depression, and that will then help the memory. We already talked about the fact that when you have lupus, you're at risk for accelerated hardening of the arteries, atherosclerosis. And we have made this a big focus of our research here at Hopkins. So many of you have met Dr. Kiani, who's so persuasive, isn't he? So this is the work that he helps with. We want to detect hardening of the arteries at the earliest possible stage. So here's the earliest possible stage, the green. What is that? That's the plaque before it hardens. So we call it a non-calcified plaque. If we can just figure out why this is happening at such an early stage, our hope is we can prevent it from getting worse. So what has he discovered? He found 3 different reasons so far why people with lupus get this very early stage of hardening of the arteries. And it turns out being overweight. Did you know that fat tissue isn't benign? It's making inflammation. High blood pressure, and an amino acid in the blood called homocysteine. Now, this only happens to about 10% of people with especially if any of you have had to take prednisone. And high blood pressure, it's everywhere, isn't it? So now you understand again why your personal NAG advises you at every visit about how important it is to maintain a healthy weight, keep the blood pressure below what? 120. And of course, we will measure this for you and let you know that as well. Now, we thought maybe we could just prevent this problem altogether by using one of the statin medicines. So we took the torvastatin, you know that one is Lipitor. And this was a study we called LAPS, L-A-P-S. And 200 of you were in it. It was a 2-year study. And it was so disappointing because the statin did not prevent this accelerated atherosclerosis. Of course, it's very good for treating bad cholesterol. So if you have bad cholesterol, you should be on it. But it doesn't prevent the lupus portion of accelerated hardening of the arteries. But at least we found this out. So we can teach the world, everybody who's in the laboratory, they have to help us find a better way to prevent the lupus portion. Now, some of you have had a terrible course of lupus, you've been hospitalized for it. What are we going to do differently so that lupus never gets so bad that someone has to be in the hospital? I want to go into just a little bit of immunology. The biggest advance, and by the way, it was the first new medicine FDA approved for lupus in 53 years, is belimumab and Lista. I want to show you where it works. We all have white blood cells. They're called myeloid dendritic cells, and they make a compound called List. It's not like it's something good, E-L-I-S-S. But it's not. It's B lymphocyte stimulator. It keeps the B cells alive that are making lupus antibodies. So, turning it down, shutting it off, was the hypothesis behind the development of belimumab and Lista. And Lista was approved because about 12 of you were in that trial. We participated in those trials. And it was shown in people who had low complement or anti-DNA and very active lupus that this medicine could get them under better control, but sometimes it took as long as a year. So they're still looking for something that's going to be fast, and we're still looking for something that will work if someone doesn't have low complement or anti-DNA. But we're still enrolling in a trial for the new subcutaneous form. I will always tell you if you're eligible for clinical trials, and then it's always up to you. There are warnings. There was a small increase in deaths. There was a small increase in serious infections. Some people are allergic. There was a minimal increase in depression. I have to tell you that 30% of people with lupus also have depression. And there's a rule. We're not going to roll out no live vaccines. I think most of you have learned that rule. Now, for those of you who have those blood clotting antibodies, I have good news. If you have a blood clotting antibody like lupus anticoagulant, 20 years after your diagnosis, you have a 50% chance of having a blood clot. That means a stroke or a heart attack or a deep venous thrombosis. The good news is my favorite drug. Yes, hydroxychloroquine plaquenil helps prevent blood clots. Now, we found this out way back in 1994. Isn't it nice that everybody now agrees? So that same hydroxychloroquine that I'm depending on for your lupus is also going to help prevent blood clots. That's huge, because remember, hydroxychloroquine is so safe. But I also usually add a baby aspirin, because a baby aspirin is important in the prevention of strokes and heart attacks. So we have kind of like a double protection against having a blood clot. Now, we don't have all the answers. And so one advantage about Hopkins is we have brilliant people around the corner who help me think outside the box. And one of those people is the chief of hematology here. His name is Robert Brodsky. Because he is an oncologist, he's always on top of the game on how you treat blood cancers, for example, or other blood diseases. And he has felt for a long time that in with the goal of a cure. And so I think I've told all of you, I expect to see a cure for lupus maybe in the next 20 to 25 years. It's not going to happen right away, but it's going to happen. So what is he thinking of right now? This all happened because of one of my patients. I don't know if she's here, but all of you owe her a huge debt of gratitude, because she was born with sickle cell anemia. And then she got lupus. It was like the world's worst lupus. Everything we threw at it, it didn't matter. She still had 3 grams of protein in her urine. Well, her sickle cell was getting worse and worse. I think many of you know that sickle cell is eventually a fatal disease. And so she underwent a very special bone marrow transplant. Very special in that it wasn't from a stranger. You know how hard it is to find a match? You know, when someone has leukemia, they're out canvassing the neighborhood, asking people to be tested to see if they're a match. Very hard to do that because most of us don't have matches. So this was from one of her parents. And this is called haploidentical, meaning it's only half identical to her. But because they perfected how to do this in hematology, this was successful in curing her sickle cell. And of course, then every month I'm there to cure her lupus. And like for the first 6 months, nothing happened. And the chief of hematology was emailing me every month, Michelle, what's happening? And nothing. And then after 6 months, everything improved, and there's no more urine protein. So she's been cured for both her sickle cell and her lupus because of the special kind of bone marrow transplant. Now, of course, we're not going to do this for people who have mild lupus, but we will test it for people who have the very worst lupus, probably starting mid-next year. So these are the kinds of challenges we have that can be met by research. So where is lupus going? Well, remember that belimumab and Lista? There are now 15 different companies testing new biologic medicines for lupus. They won't all work, but some of them will. And that will give us more choices for people who have really bad active lupus. Hydroxychloroquine, plaquenil, that's going to be around forever, isn't it? Because it's so safe and because of its prevention qualities. We are using it more in people who don't yet have lupus, and people who have milder autoimmune diseases that has a really long name, undifferentiated connective tissue disease. We're starting hydroxychloroquine and plaquenil early so they won't develop lupus later. And can you imagine someday if we could figure out which one of your children was destined to get lupus? Would we just let it happen? Of course not. We would give that child hydroxychloroquine starting at about puberty. So hydroxychloroquine, isn't it ironic that it was developed for malaria? But now it's ours. Now, think of all the things I haven't answered. I don't have an answer yet for the accelerated coronary artery disease. I don't have an answer for fatigue. Remember, I've told you 30% of you is going to be fibromyalgia, but I don't explain it in everybody, do I? And then, of course, the memory problems. So that's why every time you come, you may be met by Dr. Chiani or one of the other research coordinators who will ask you, can you help? Because people who come to Hopkins, you're helping not just yourself, but you're helping probably 3 million people worldwide who have lupus. You stand up and are counted on behalf of all of them. Now, this is something that Albert Einstein said. If we knew what we were doing, it wouldn't be called research. If I had the right answer, I would just go ahead and do it. But remember, I thought I had the right answer when we gave Lipitor, and it wasn't the right answer. This is why it's so important to scientifically test. Now, at this point, we're going to open it up to the questions, and so I think Jessica is going to start getting any questions. Now, I know I won't get to all the questions, so what I'm going to ask you to do is, those of you who are my patrons should just email me the question, just like always. So the first one is, if you have those blood clotting antibodies and you already had a stroke don't substitute if you've already had a blood clot, then you need warfarin. Now, the next question is that a person has facial rashes that are leaving scars. What can I do? Well, if I can't address it, I will send you to a dermatologist. Because when you have lupus, other things can happen to your skin besides lupus. But the discoid lupus, that one that leaves scars, it's very important to treat it aggressively. Okay, so this next question is what happens when doctors don't accept your insurance. That can happen if you have a limited insurance, then they allow you to go to the University of Maryland and not Hopkins, or vice versa. And if you have medical assistance, there'll be a limit on where you can go. But did you know that your doctor can ask for my help whenever they want? Doctors email me for advice the same way you do, and I answer all emails. So if your doctor has a question, would you please reassure him or her that my email is for them too? If I can have the next set of questions. This question is something about having spasms and jerks. Here's an example that on everything that happens to you is from lupus. So if you have muscle spasms and jerks, that's called myoclonus. It can happen to anybody. People often have those jerks just when they're trying to go to sleep. And it's benign, not related to lupus. The next question is, what percentage of people with lupus benefit from Benlysta? In the clinical trials, it was only 12%. In that 12%, though, that's really important. But just our standard of care benefits a lot of people. The next question is, how do pet dogs affect lupus? That was the infection study you saw on your slide. When the vets did that study, they interviewed the pet dogs of people with lupus, and then interviewed the pet dogs of people who were controls. And it turns out that the pet dogs of people with lupus were more likely to have lupus as well. And that probably meant that the dog was exposed to the same environmental triggers that the owner was. So you don't have to worry. If you have a dog, it's fine to keep the dog. Now, the next question is what about some of the pain remedies? Please be very careful about narcotics because you know they can cause dependency. But even more important, research studies have shown that narcotics do not help fibromyalgia pain, and sometimes even make it worse. So if you're in a pain clinic and the doctor isn't up to date on the work on narcotics and fibromyalgia, just ask me, and I'll give you those references to give to your doctor. The next question is, what is the recommended dose of hydroxychloroquine? If you have a normal weight, it's probably going to be 400 milligrams, but the dose must be adjusted if you're very tiny or you have any kidney problems. So again, that will be done individually. And if you lose a lot of weight, always check to see if maybe the dose should be reduced. The next question is, does secondhand smoke affect you? Yes. It's just as bad as smoking yourself. So we want everybody in your household to stop. And the next question was, does menopause affect lupus? It's the medicine that affects lupus, so we do not recommend hormone therapy after the menopause because it increases lupus flares by 20%. But also it was shown in women who don't have lupus that hormone therapy increases heart attacks, breast cancer, Alzheimer's, gallbladder disease, and blood clots. So many good reasons not to take hormone therapy. Now the next question is, once you have one of those discoid scars, or the skin turned white or dark, or the hair is gone, is there any treatment? No. And that's why we must prevent it before it gets that bad. When there's permanent loss of hair, it's because the hair follicle is gone. It's scarred. When the skin turns white, the pigment is gone. When it turns dark, there's too much pigment. There may be hope in the future that some kinds of laser therapy might help, but right now dermatologists are so cautious because laser therapy sometimes even activates the discoid lupus. The next question is, is, how do we test for the memory problems, like being confused or disconnected? If it's getting more severe, I will send you to the cognitive psychologist for the formal memory test. And then they tell us what we need to do as the next step. The next question is, does plaque and hydroxychloroquine cause weight gain? No, but prednisone may, because prednisone may make you feel more hungry, and if you give in to that, you will gain weight. And when the prednisone is reduced, that weight will stay. So it's not the little prednisone pill that caused the weight gain, it was your increasing your calories. So I know it's so awful. If you've inherited a slow metabolism in your family, it isn't fair, but you have to eat less than others do, and you have to exercise more. So the next questions are, is there any new research if you have a very low platelet count? Most people with lupus only have a mildly low platelet count. You can live with that. In fact, quite often, I'll write mild next to your laboratory test to reassure you, you can live with that. But if someone has life-threatening low platelet counts, yes, there are a lot of new treatments. But there are some old ones we still use, one called rituximab and one called intravenous immunoglobulin. But lots of new ones as well. Now the next one is, can I take a baby aspirin? Please remember that generalized questions like this, I don't know. I have to make an individual decision in each one of you of whether you can take aspirin, or perhaps even more importantly, should you take aspirin. The next question is lupus genetic. Remember that 2/3 of the cause of lupus is genetic susceptibility. You're not inheriting a mutated gene like in cystic fibrosis or sickle cell. You're inheriting genes that make you more susceptible to autoimmune disease. Now, why are those genes still in your family line? You got to go back centuries when the plague, the Black Death, hit that city. Guess whose family survived? Your ancestors. Because those genetic susceptibility genes mean you have a more active immune system. So your ancestors were more likely to survive plagues. Well, we don't have plagues anymore, at least I certainly hope we never do. So now, those genes are not a plus for your family, they can be a negative. Now, the next question is about a rare complication of lupus called gastroparesis. It means slow stomach. The stomach doesn't empty well. And the question is this related to medication? No, gastroparesis is related to lupus, but it's very rare. People who have it have hiccuping and bloating, that kind of thing. But if you're on a narcotic, it does make it worse, because one of the many side effects of narcotics is it slows the entire gastrointestinal tract. Now, the next question is in lupus in children about facial rashes. If there's the lupus rash, and remember, lupus rashes occur after sun. They're raised because inflammation causes them to be raised, and they last for days to weeks. If there's some doubt about what the facial rash is, you need to see your doctor or a dermatologist. Most red faces aren't from lupus. They're from things like flushes, blushes, seborrhea, acne, rosacea. So the first step is always an accurate diagnosis. So if you do suffer from lupus rashes on the face, you must use your sunscreen. And you know you really have to put a lot on? It's a physical blocker. I know this stuff is expensive, but if you don't put a lot on, it doesn't work. And you have to put it on 15 minutes before you go outside. And even in the fall, winter, and spring months, you should shade your face with a hat with a brim. The next question is, how hard is it to get pregnant when you have lupus? Not hard at all. Lupus does not affect fertility. But please consult with me or your doctor before pregnancy to make sure that all the medicines are safe. So, remember, cell-set-mycophenolate can't be given in pregnancy. Those ACE inhibitors and ARBs that I'm giving for everybody who has kidney lupus or blood pressure cannot be taken during pregnancy. These things cause birth defects. So have a planning meeting with me or your doctor to make sure that I've given you the green light. Now, I don't want you to think pregnancy is perfectly safe in lupus. It's not. We consider it high risk because kidney lupus can So when you're pregnant, we have you go to the high-risk clinic, either here at Hopkins or another hospital, so that you and your baby get the very best OB care. Now, the next treatment study and question is about treating thalassemia. Thalassemia is not related to lupus. It's a genetic cause of anemia, and it's treated just by taking folic acid every day, so it's completely unrelated to lupus. So this question is, what about musculoskeletal problems in lupus? About 90% of you have joint stiffness from lupus, and some of you even have true swelling. And it's not in every joint. It tends to settle in the middle knuckles and the knuckles that attach your fingers to the hand and in the wrist. And sometimes in those small joints that are the duplicate in your feet. The number of minutes of morning stiffness help to tell me how severe it is. Now you remember the P in prednisone stands for? Poison. Well, here's the problem. Prednisone makes joints feel. So again, we have to do this balance.